Jason back again doing some postural release work. This time we're working on the upper trap and also working around the first rib, which that upper trap complex tends to become it just comes up with a lot of people and you'll notice it, and you'll probably feel this way anyway. Lack of breathing, myself and Nathan went through it in the first video. Everybody's quite stressed, we take very shallow breaths, so we're always up here. And what that is causing as well is this scapular kind of just moving up the back, and it moves everything forward and you get this whole position, and this is just part of it. So what we're trying to do is, with the active release techniques that we've been doing, is you're pinning it all down. So you're locking everything down, you know, everybody tells you to keep your shoulders, and you're moving through a range that these muscles become overactive in. So someone such as Jason, who loves doing his overhead pressing work, and anybody that goes to the gym, naturally a lot of people really struggle to get full flexion without compensating through the lumbar spine. So what we're going to be able to do here is work through that and strip that back so he can get that movement. So it's literally as simple as pinning it all down and doing that exact movement to get into that range. And this one's pretty tough because of all obviously the nerve complexes that are in there in this space. You've got to be quite careful, but also you've got to realise that some of the pain that's going to come through it might actually radiate just behind the eye. It's not the worst thing in the world. You just got to be careful with it, okay? So what Jason's going to do is he's pinned it down. He's just in the muscle bulk in the upper trap, and he's just using a pole that's stuck into the wall, and he's just using that, and of course applies pressure this way with his feet. And he's literally just going to do any movement that he really feels finds that point of pressure. And you may have seen him close his eyes then, it's not the nicest feeling. You also want him to work pretty hard in getting full range, so he's going to want to try and fully extend. You can give him a little bit of assistance, but he can do that himself, as you will be. Okay, make sure you're breathing with this one. This is really important, especially with as I mentioned before, the fact that nobody really breathes properly can make these really tight. So you want to breathe while you have the chance. Jason's going to go through, say, 3 or 4 different movements and then see how he feels after it, and also if his shoulder flexion has improved. Again, we didn't do a test for this one, but you always want to do a test retest, really just to show how much it can improve. And this is one that I use on a regular basis because it really does help me. Jason will do one more, we'll see how he goes. And of course you want to move slowly. A few little twitches, and relax. Of course you want to go for about 1 minute to 2 minutes, just relax into it and breathe, just shoulder twitch. All out. Get rid of that. All out. Pretty comfortable? Yeah. Good. And you can hopefully see the difference just there. Alright, that's another one.